Assalamualaikum warahmatullahi wabarakatuh. Shalom, Om Swastiastu, Namo Buddhaya. Greetings of virtue and peace and good health to us all. Good afternoon and welcome to the G20 Digital Innovation Network's Healthcare Pitching Session. My name is Paul Palelli and I'm both thrilled and honored to be your host for today's event. First and foremost, I'd like to start by thanking you all, whether you're attending here in person or joining us virtually, to take time out of your busy schedules to be here with us today. And to kick things off, allow me to start by extending our warmest welcome to our guests of honor and our judges for today, two of which are joining us here in person and one that is joining us virtually. Our first judge is a senior principal at Kearney. He's a career management consultant with 14 plus years of top-tier strategy and operational consulting experience across the Middle East, Europe, and Asia. Throughout these years, he has delivered and led approximately 70 consulting assignments covering diverse topics. He brings deep expertise in ICT and digital trends, business models, and regulation, developed through advising CXOs, government ministries, and regulators on strategic issues, and designing and implementing solutions with tangible impacts. He also has a strong passion for emerging technologies such as 5G, cloud, artificial intelligence, and machine. Please welcome Mr. Rohit Sethi. Our second judge is a technical officer in innovation at the World Health Organization. Most recently, she was the head of healthcare transformation at the World Economic Forum. Prior to the forum, she served as Deputy Minister of Health and Chair of the National Health Insurance Fund in Bulgaria. And in that capacity, she was also the chair of the Standing Committee of the Regional Committee of WHO Euro. She holds a BA from Bowdoin College, MPA from Princeton University, and PhD in Health Management from the National Medical University in Sofia. Please welcome Ms. Desislava Dimitrova. And last but certainly not least, joining us virtually, she is the co-founder and managing partner of Anchor Capital Fund, the early stage fund that invests in transformative technologies for the next billion Indians. They also invest for high returns in non-conventional opportunities in these markets and have been pioneers in agri-tech investing in India. The Anchor Capital Fund portfolio covers across ag tech, health tech, ed tech, fintech, and other enabling tech up to $5 million. Please welcome Ms. Rema Subramanian. And also a big welcome to all of the government representatives, the founders of the 10 startups that we will be hearing from momentarily, as well as all the other invitees. Now, before we begin, I would like to just run through the format of the presentations for our startups today. Each startup will have 4 minutes to make their presentations. There will be a 10-second warning with a little bell right before the time is up. And following that, the judges will ask one question to each startup, in which the startup will have 3 minutes to reply. And following that, the judges will then have 1 minute to score each startup. Lastly, we also invite anyone in attendance here to also take part in the scoring of each startup by scanning the QR code that we are going to put up on the screen after each presentation. Distinguished guests, ladies and gentlemen, before we begin today's event, allow me to introduce first the 10 startups that will be taking part in today's event. From the healthcare category, we have Heidi Health, Genome Insight, Arficus Private Limited, Nusantix, Cura, Capsula Inc., Maya MD, Fuse AI, DDM Health, and NP. All right, ladies and gentlemen, we have a very exciting presentations coming up. So let's begin today's pitching session by welcoming our first startup who is already joining us online. Please welcome Heidi Health.
Hello everyone, hi, I'm Tom. Should we get started? Can you guys hear me okay? Sorry, I just don't want to jump in and make sure.
Go ahead, the screen is yours.
Perfect. Well, hello everyone. I'm coming to you from Australia in Melbourne, and I'm Dr. Tom Kelly. I'm the CEO and founder at Heidi Health. You can hit on the next slide. So So we're a seed-based company. We've raised $5 million at the end of last year, and our core belief is that in the next 50 and 100 years, medicine will look like doctors and nurses and clinicians working with AI to deliver the best patient-centered care. Next slide. And what we do at Heidi is we combine AI and beautiful software to power that future of medicine in a very beautiful and delightful experience, which I'll tell you all about. Next slide. So our mission at Heidi is really to try to eliminate misdiagnosis. Misdiagnosis happens in three main ways. One way is when patients just can't get access to care, they can't afford a doctor, or they can't, travel hundreds of kilometers to find someone to help them. The second thing that can happen is that patients can fail to present. So maybe they can see a doctor, but they don't know much about healthcare or their symptoms. And then the third thing is that doctors, when they do see patients, make mistakes. And I know that being a doctor myself. So, 1 in 7 visits will have a diagnostic error in Australia at least, and most of them are preventable. You can hit next. So what Heidi does is it connects to medical record systems, hospital records, and creates a patient profile. So we use AI to create a patient graph. We look at all the features of that person and start to understand what drives their healthcare outcomes. And if you hit next, so before a patient actually sees a doctor, they start their booking with Heidi. So Heidi will do a pre-consultation, we'll ask them some questions, and based on that profile we've created, we'll try to gather all the information that really matters to make sure that they get a perfect management plan in the actual visit with the clinician. If you hit next. So not only for the patient, but for the doctor, the benefit of using Heidi is that we actually speed up the visit and automate a lot of it. So you'll see that summary written in the corner there. So that's written by our AI, and doctors can copy that into their notes. We also provide a differential diagnosis and management plan suggestion as well. And this really means that you've got a supportive layer that helps you be a great doctor and have that AI supporting you as you do the visit. And you hit next. And then once you make the plan, you send it all back on Heidi. That goes back to the patient's app or their personal profile, and Heidi will actually automatically make sure the patient executes on the plan. Hit next. So we're already working with some clinics and we've been able to drive top line revenue increases up to 50%. But I think the big opportunity here in a publicly funded setting is to obviously reduce costs as well. You can hit next. So we've got a big founding team, a lot of amazing people. Waleed, myself, and you have previously founded a healthcare business that reached $5 million ARR. So we've done this before. We exited that business and founded Heidi, and we've multiplied that with some amazing talent around Australia. Jackie, Eliza, and Tim are just some of them. Get next. And so far, with our traction, we've created a world-class AI. So because Heidi is actually in the consult, every visit we see actually helps us get better, which is a rare thing in the industry. If you hit next. And so we're in beta with 5 clinics in Australia. There's 30 more in our backlog, and we've had almost 100% hit rate in the demos. Hit next. We've got early US customers. Next slide. We've got some early US customers. If you hit next slide. Yeah, we're on track to hit $2 million ARR by the end of next year. And there's one more slide. Hit next. Yeah, that's okay. Yeah, this one here. That's fine. Yeah, I can talk around the questions. Thanks so much, guys. Appreciate the
Thank you, Heidi Health. Yeah, big round of applause, guys. For Heidi Health, we're now going to invite Ms. Rema Subramanian to ask a question in which Tom, you'll have 3 minutes to answer. Go ahead.
The question I have is, who is your primary customer?
That's a good question. So I think it depends on the application. So in Australia, our primary customer is patients, because patients will pay a service fee to access Heidi from their clinic. The reasons that patient would pay a service fee is because we're offering a digitally enabled experience that they wouldn't otherwise get. So for example, they'll get their prescriptions, their documents, referrals back to the patient portal, which they wouldn't otherwise get. In the long run, our payer will ultimately be probably the actual provider. So whether that's the public health system or the doctors. In the initial go-to-market, it's easy to sell to a doctor and say, you pass it on to your patients and you still book the same amount of revenue, so it's low risk for them. But what we're seeing is that Heidi unlocks a lot of efficiency for them. So ultimately, patients will probably end up paying the same as they otherwise would, but the doctors will just absorb the additional efficiency and the fees that Heidi charges them because they're unlocking more visits and a new way of seeing patients.
So initially you have to select the doctor or the patient. One person will be paying for it, but who's the first person you're going to convince?
So we've already sold to doctors because doctors pass it on to their patients. So they'll sort of like if you were booking a hairdresser or something and they had a way to book online, we sell to the doctors and then they provide Heidi as a way to book with them.
I don't see that as a challenge.
No.
One of the global challenges is scaling up and selling it to doctors.
Yeah, correct. We've had a really good track record so far. So I think it would definitely be difficult if you were just selling like a single feature product, but with Heidi, we're offering quite a suite for them to really speed up their consulting. So far, it's been going well. Like of in-person demos, we probably had 80 to 90% success. I think the difficulty in scaling that will be like a B2B sales motion. We found LinkedIn to be really successful. But yeah, it'll take time, I think.
Got it. Thank you.
No worries.
Okay, thank you.
No worries.
Okay, thank you, Heidi.
Okay, thank you, Heidi. Thank you as well. To our judges, we will now allow 1 minute for your scoring.
Thanks again, Heidi.
Thanks again, Heidi.
A quick reminder to all of you in attendance right now, you're able to scan our QR code on the screen. And please do take part. This is your opportunity as well to help score the startups. All right, as we wrap up the scoring for our first startup, we'd now like to invite our second startup, Genome Insight. Come on up. All right, thank you. 4 minutes. Go ahead, the stage is yours. Thank you.
Good afternoon. Jae-hee Seo at Genome Insight. Thank you for giving this opportunity to share our story at this company. Genome Insight, we're a cancer company and we're a cancer diagnostic company. There's a fundamental problem in how we look at cancer today. Cancer is a big disease. I think we have about 30, 40 people here. About 15 of us probably will die of cancer, so it's a serious issue, obviously. It's a disease of the genome. It's a DNA issue. It's a acquired DNA mutation that causes all cancers. And that's just the nature of all the different types of cancers. A complete assessment of all your DNA, your normal cells and your cancer cells, and understanding exactly what happened in those cancer cells should be the theoretically correct way to understand the cancer. To cancer patients, we have the technology to read it and analyze it and provide clinic-ready interpretation reports to the doctors to inform their medical decisions and change treatment strategies. Company itself, foundation in South Korea, originating from a group of professors at KAIST University, genome scientists. We've also have offices in different locations in Korea and also in San Diego. Dr. Young-Suk Ju, the founder of the company, a genome scientist and oncologist himself, did a lot of research over the last 10 years, gathered a bunch of people, MD, PhDs, to work together. So a really strong group of genome scientists, also with deep expertise in oncology and rare disease, coming together to build this solution. Myself and a few others coming in as the executive team in medical insights and business insights. And this is a picture that we often use about what you'll see with our solution versus the current technology. And this is the pillars of creation. It's up in the sky. The Hubble telescope 20 years ago got that picture in the middle, and a beautiful picture of the pillars. And now, you know, amateur scientists and, you know, people can get the pink picture as well easily, but the recent near-infrared telescopes provide a very different picture of the same thing. And just looking at those stars, there's going to be so much more information and so much more insights that you're going to come up with. Our technology is going to be like that. On the very right, if you read the whole genome, there's a bunch of different levels of information that you can give. And that's the picture of the mutations that are in your cancer cells versus the current technology that are practiced in everyday life on the very left, pretty empty. That's like 0-something% of your whole, you know, mutation sets. So you're looking at a vastly different information set. And on this is for the same patient. Our technology comes up with 6,000 mutations versus the old technology would come up with 6. We have a beautiful software. It's a high computing software with high cost servers coming in. We can do all this analysis in about 10 hours. There's a computer software. You need to visualize the data. It's going to be gigantic data, 200 gigabytes of data, the whole genome. How do you put it on paper? There needs to be a computer software. There's a bunch of cases. We've done 5,000 sequencing efforts on cancer patients, so new insights coming out every day. And we want to become a platform company. We have an engine, which is the algorithm to do better work. More data's coming in, which will inform the engine, which creating a virtuous cycle. Business model-wise, we'll do therapeutics, data business, and then informing pharmaceuticals to make better drugs. And we're ready to go to market, and early next year, we're going to launch this in Korea, and then later on, going to other countries in the world. Thank you for your attention.
Thank you, Genome Insight. At this time, I'd like to invite Mr. Rohit Sethi to ask a question for Genome Insight, in which you'll have 3 minutes for reply.
Right. So I think you believe you have come up with something really innovative, right? So what would be the market size, addressable market, right? Because I think the problem is clear, but are people willing to pay? Who is going to pay for this?
Cancer itself, $200 billion market in America alone. I'm from Korea. We have about 200,000 new patients every year. On a per patient basis, this is going to be the blueprint for the rest of the treatment. So this is going to be an important part of the cancer treatment journey and the beginning part of it. Current price point with our technology is going to be about $1,500. Our goal is to make that at the $500 level in about 3 years. The old technology being used today, the reimbursement price, at least in Korea, is going to be at $1,000 to $1,500. So we're not too far off from the current technology price point, which is allowing us to launch in the market next year.
Go ahead.
What about the competitive landscape? It seems like such solutions like 23andMe, etc., also exist. How do you compare to them, and what's superior?
Yes. We're more on this very specialized side, 23andMe, and those would be more on the ancestry, fun gene type of categories. There are companies like Foundation Medicine in the US, Tempus Labs in the US, which are more focused on oncology care and providing reports to doctors so that they can inform the patients. Those companies are competitors, but they're using the old technology, and the whole genome sequencing and analysis is really coming from the academic power that our people have. And we believe that we're at least a couple of years ahead of competition technology-wise. It's going to be our mandate to get to market before they do and create the market so that we're the leader in the standard of care over there.
We have about 1 minute left. If there's any more questions from the judges, feel free. If not, we can end the Q&A. All right. Thank you. Genome Insight, you may take your seat, and now the judges, you'll have 1 minute for the scoring portion. And the rest of you as well, as per usual, you can scan our QR code to take part in the scoring as well. All right, very exciting stuff so far, but we're just getting started. Still plenty more to come here on day one for the healthcare segment. And for our next startup, our third, is joining us virtually. Please welcome Arficus Private Limited. Arficus Private Limited, are you there? Yes, great. Thank you. The screen is yours.
Hello, everyone. Very good afternoon. This is Sandeep Sinha from Arficus Private Limited. We are hailing the medtech sector from India. Medni, the word coined, starting from the very niche. Medni is a term coined from the Shiv Puran that defines the healthy nature. What Medni is? Medni provides the artificial intelligence-based disease diagnostic, screening, and prediction SaaS platform. We are envisioned to provide the good health a synonymous to Medni. Hit next. Hit next, please. We have umpteen number of diseases out there, which each passing day, due to climatic changes, due to each pandemic waves, and due to each and every single, so we are engulfing into the new diseases which no one has ever thought of, like of mucormycosis, right of monkeypox, and many others, which are the current market size of $58 billion and an expected market size of $1,041 billion. We are leading for the diagnostic industry. Hit next, please. It started over in 2019. We have closed $1 million revenue last year, and this financial year in the last quarters and so far we have closed a $500K revenue over in our approach. We have 5.3 global patents. Please next. Now the most interesting part. First of all, there are all my peers which we do have. We have a big number of areas which we do diagnosing over in cancer, which we do diagnosing over in COVID and in other places. So first and foremost, artificial intelligence-based accurate disease diagnosing to which we provide for the rarest diseases, for the early stage diagnosing, for the patient future and prediction modeling, and for the disease surveillance and effect analysis. What we do, we not only provided diagnosing over at the early stage, once we get the disease, we'll provide diagnosing is what we always look it upon. But have anyone ever thought that we could curb the disease over at the very nascent stage? That is what Medni is all about. Please next. It's a healthcare-based startup, started in 2019. You can move on to the next please. The first and foremost, the most accurate, the most problem is to provide an equitable and affordable disease diagnosing to each and everyone across the globe is what we are looking at forward. Please next. Please next. Yeah, the very own, what the disease diagnosing which we provide, monkeypox, otitis media, melanoma, carcinoma, kidney, ailments, diabetes, cancerous, Alzheimer, breast cancer, pneumonia, brain stroke, heart attack, and leukemia. We provide the early stage diagnosing with a 98.31% accuracy and a WhatsApp and voice-based listening to no one which ever provides over in the market as of such. Moving on to the next please. The Resonance 50 algorithm with a Keras-based segmentation is completely in-house with a three global patents filed, and we are always out there in the market to rule it across. Please, move next. Please move next. This is how a solution looks like. Please move next. The clinical validations and certifications to which we do have. Please move next. With a 93 client base and presence across 5 countries, we are hailing a crossover for the diagnostic and prediction platform. Please move next. Now they started from the journey from in 2019. We are out there with a 2 leaps which we are trying to take it across. One for this disease prediction platform at a very early stage which we are trying to do, and second is the Medni sensor platform to diagnose the disease at the very early stage in lieu of the diagnosis which we do provide. Thank you. Last, can you please take a last slide on the team? Last slide. Next slide, please. Next slide, please. Next slide, please. Next slide again. Yes. Just the previous one. The interoperability analysis to what Medni for humans is out there in the market, and what we are looking at forward for the climatic changes provides the heck number of diseases to each and everyone out there across to the public with many new diseases offering on the board, which no one has ever even thought of providing over to diagnosing and prediction at the very early stages. What Medni is provided with the predictability and interoperability analysis platform. We are doing it, and we have provided the results for the monkeypox and for the mucormycosis, and we have submitted the report to the government, and we were 99.67% accurate in our approach. So
right.
the interoperability analysis.
I'm sorry, your time's up. I'm going to have to cut you off. Thank you. We could perhaps proceed in the Q&A session. And at this time, I'd like to invite Ms. Dimitrova to ask a question.
Thank you. Just like in Heidi Health, I'd like to understand better who is your patient, who is your customer, who is the patient, and if it's the patient, are they enabled by doctors? Is the AI enabling and empowering doctors or patients? And how is it being funded currently? And also about the team, I didn't hear anything about who is behind this.
Okay. First of all, very good afternoon. With the team side, me, Mr. Anurag Jain, the co-founder. I am an ex-Microsoft. Mr. Anurag Jain is an ex-Google. With our CEO, Mr. Somniji Bhoj, again an ex-Google, and Mr. Janani Natarajan, he is an ex-Microsoft, and I am an Ahmedabadi graduate, who graduate. In lieu of that, from the medical expertise, we do have Dr. Vishwajit Devka from Johnson & Johnson Research, Dr. Niladri Dev, and Dr. Harvey Ring from AstraZeneca UK. We have the entire research and development center set up across the UK region, and our primary customers, we do have hospitals, diagnostic centers, primary healthcare centers, nursing homes, as of such. Because we are currently entirely into the B2B market segment, and the B2C market segment is yet to penetrate, which will be taking it across for the next in our approach, which will help us to cross our valuations into cross-10 and reaching out to a valuation of almost $100 million, and we are looking for a $1 million valuation by 24 years. With a 2 new leaps of the prediction platform and the sensor-based analysis over in our approach.
Okay, we have about a minute left. If the judges have any other questions, you may proceed.
What is your product? I don't understand at all.
Sorry, ma'am?
What are you doing? What is that? I couldn't get that at all.
Okay. Ma'am, so provide over to diagnosing of diseases that comes from monkeypox.
What diagnosis? What is it that you do?
Okay. So the diagnosing of diseases from monkeypox, otitis media, melanoma, carcinoma.
Sorry. What do you do? Are you testing blood? Are you testing? What are you trying to do?
It's a diagnostic.
Diagnosis of what? Are you taking radiology? Are you taking X-rays? Are you taking blood cells? What diagnosis are you doing?
That depends on the type of diseases we want to test. Suppose if I take over an example for...
Understood. I think the time is up.
Okay, thank you. Thank you, Africa's Private Limited. Your time is up, and we are now going to allow the judges 1 minute for their scoring. And once again, we invite everyone as well to take part in our scoring system by scanning the QR code up on the screen. And in the meantime, we'd like to invite our fourth startup who is here in person, Nusantix. Come on up as we wrap up the judges' scoring. All right, Nusantix, the stage is yours. You have 4 minutes.
Right. Good afternoon, everyone. I'm Revata from Nusantix, and we do microbial diagnostics for One Health. Next. So every year, even before COVID-19, Indonesia suffers from about $310 billion of productivity loss due to microbial-induced diseases. So for human health, it can be as annoying as your typical diarrhea from salmonella infection, or it can be as damaging as HPV-HR infection that causes cervical cancer, or even HIV infection. In other areas like aquaculture, it can mean a sudden death of 90% of your shrimp in your farm, or the most recent cases of cattle foot and mouth diseases outbreak, which reduces the supply of beef meat and also dairy, reducing the economics of food sector. And those are just a few examples of the huge problems that we're trying to solve. Now, we see early and precise diagnostics as the most important tools to prescribe solutions, the right solutions to all these problems. Next. So at Nusantix, we combine our expertise in molecular diagnostics, microbiome science, and artificial intelligence to build the largest microbiome database in the region, which we use to develop an affordable, non-invasive PCR and next-generation test kit and testing services to address this low-hanging opportunity of $6.5 billion. So we approach and deliver impact to these three main business pillars. The first one will be the human health and wellness. Second one will be the food safety from the livestock and environmental health. So far, we've delivered real impacts to society. We've produced and distributed over 7 million of COVID-19 PCR test kits across Indonesia. That's to help our government ensuring affordability and accessibility for our citizens. And as recently, we launched a new shrimp disease PCR testing services to help shrimp farmers reduce their death rate by early diagnostics. And of course, our team of scientists is working hard day and night to produce and deliver the most comprehensive antibiotic resistance TB NGS panels to the market. And fortunately, we are at the rightmost place that we can show impact and business sustainability come hand in hand. So Nusantix has been profitable and also has a strong financial foundation, even since the first year of our establishment. Last year, we grew 7 times year on year with a transaction value of $50 million. Just starting. We continuously to expand into various high demand applications where we target 30 million testing and test kits to be sold by 2025. Next. In terms of our positioning, we are well positioned in Asia Pacific region for both competition and collaboration. So why do we say both? Well, for local markets with local diseases, with local circulating variants, we are the market leader for it. But for global diseases like TB, we are actively seeking collaboration and also collaborate with healthcare stakeholders, because only through collaborations that we can deliver real impacts. Next. And speaking of impacts, that's what drives our team. We have a highly diverse and also capable scientists from world reputable universities with a world-class scientific advisor like Carl Whitwer, who's the grandfather of real-time PCR, whom himself is an entrepreneur like us. And we are the only startup in Southeast Asia that is a part of the prestigious Illumina Accelerator program. So, judges, thank you so much. It's been an honor, and I hope we can embark on a journey together to accelerate microbial diagnostics for One Health. Thank you.
Thank you, Nusantix. And at this time, I'd like to invite Ms. Subramanian to ask a first question. And if we have more time, you can ask additional questions. Go ahead.
So, is this what's the IP that you have? I didn't understand that.
Yeah, so we develop PCR and next generation sequencing panels. So it's a task molecular diagnostic task kit that is affordable, non-invasive as well, and we spread across Indonesia. Our first case use is COVID.
Sorry, go ahead.
Yeah. Our first use of those task kits are for COVID-19, for example, where we deliver about 7 million tests across Indonesia.
So the PCR, so basically you have a manufacturing setup to do that, or what's the IP that not your license and
our business model spans from B2G, B2B, and B2C as well. So in a sense, we built the technology here in Indonesia. We developed them ourselves. We licensed them to manufacturers like state-owned companies, and we also supply the raw material for production. And then the task kits are being sold to B2B labs, and also ours as well, that we deliver testing to citizens right away. And that's for COVID-19. We're going to expand our menu to HPV, HR testing soon, and also we recently launched the stream diseases test for farmers. TB is diagnosis for antibiotic resistance. So we do sequencing for all the first line, second line, and third line drugs. Because the cases right now, about 25% of the primary infection is actually antibiotic resistance TB in Indonesia. So we want to help clinicians to be able to give the right treatment right away, improving healthcare outcome as well as reducing the cost of the healthcare.
Understood. Thank you.
Any view on the competitors that you have?
It depends on the application. So if you look at the B2G and B2B side, in terms of the test kits and the technology itself, we are competing with companies like Seegene or Roche Diagnostics. But in terms of testing, we compete with we are the only one that does One Health application testing. So from their side, we can say that Genix is one of our competitors, for example, in the stream diseases. But locally, for example, like for the B2B healthcare, there's going to be Prodia and everything else. But since we are covering end-to-end solutions from the technology provider as well as the testing services, we can actually collaborate with everyone. That's the beauty of Nusantics.
Thank you. Thank you, judges. If there are no more questions, thank you, Nusantics. Great stuff. We're almost at the halfway point here. And on day one, we're now going to allow the judges 1 minute, up to 1 minute for their scoring, as well as you guys can scan that QR code. In the meantime, we do have our fifth startup who is also here in person. Kira, come on up. As we get set for our fifth startup presentation. Okay, so as the judges are done with their scoring, we're set to begin. You'll have 4 minutes on the clock. The stage is yours. Thank you.
Excellent. Hi. When the stakes are high, we need fast, accurate, and concrete answers, especially when it is about our loved ones. This is how I felt as a father when my newly born child, Lean, 5 years ago, she woke me up late night having an ear problem. Okay. I went to the hospital, waited for around 4 hours in the waiting line until I went to the doctor, who saw me for less than 5 minutes, and then I went out. I already know the problem, we know the answer, but still, till today, 2020, 2022, G20 countries, still, I was not alone. Majority of the people wait for long hours in the waiting rooms. You get months and sometimes weeks to get an appointment with a specialist. So, I did not introduce myself. So, Assalamu alaikum. My name is Wa'il Kabli, and I am the CEO of Cura. Basically, Cura is a telehealth platform that enables you to connect with doctors, to get online diagnosis, prescriptions, and well-being therapy sessions. We deliver all of that through chat, live video calls with the doctors. So how do we deliver that? We deliver that with, next please. Yes, okay. So we deliver that through urgent care. We provide urgent care services, 24 hours doctors. You get to see a doctor online in less than 5 minutes. This is to be served across Saudi Arabia. For those who would like to have something deeper and want to connect with a specialist or a consultant, we cover more than 200 different specialties. We have more than 6,000 doctors across Saudi Arabia to answer your questions, and you get to see the doctor in the same day appointments. we don't like to wait for people to be sick. So we decided to create 25 different health goals, and you subscribe to one of these health goals to achieve. Health goals are very much aligned with the wellness program. So for example, if you want to lose 5 kilos, co-op with depression, or maybe follow up with pregnancy. So you have to follow these goals until it's a weekly session with a therapist, 45 minutes every session until you finish 6 weeks of these therapy sessions. Now, next please. Yes. So during COVID-19, we were able actually to start developing the electronic prescriptions, accept health insurances, and this was the first time in the whole country's history. COVID-19 was the real test. So when everyone was locked down, so we actually transformed our services from just being convenient to being necessary for everyone. Doctors want to stay safe. People want to stay safe at home. We want to make sure, it was our first time to everyone to show we are a reliable service. We are here to help you. We're not just convenient. So basically, after that, we even now develop 2 more services where we give you home labs, where we get the tests coming to your home, collecting the samples, and once the results are up, doctors will be actually connecting proactively with you, giving you results reading programs. So for example, whenever the results are up, they will tell you these are your recommendations in a voice note and with different techniques also. For a long time, telemedicine was illegal in Saudi, so we worked with the government to make sure that we legalize the telemedicine and make it licensed. With this, basically, this is our team. We try to bring the best of the teams to make sure that we deliver care to everyone in Saudi. If you're visiting Saudi one day, make sure that you have Kira with you. We'll be taking care of you.
Thank you, Kira, for that presentation. And I'd like to, at this time, invite Mr. Sethi to ask the first question and any follow-up questions that we can fit in the next 3 minutes. Go ahead.
All right, thank you. Thank you for the presentation. One question, what is unique about Cura? So what is your competitive advantage? You have IP or things like that?
Excellent. So the main competitive advantage is we have large network. So we are the largest doctor network inside Saudi Arabia. And the second thing, we work with everyone in the ecosystem. So we enable pharmacies, we enable healthcare providers. So we try to partner with everyone in the country, and because our mission is to digitize everyone. Make sure that you are on the digital space. That's the main competitive advantage that we have.
Any revenues you already generate?
What's that?
Any revenue you generate?
Yes. We are actually profitable starting last year, actually.
Mr. Mitrova, do you have any questions that you'd like to ask? No?
So the health insurance is currently covering this, or people are paying it out of pocket? And do you have plans to grow it outside of Saudi, or you're looking at it as a local solution for local?
Excellent. So basically, we pushed very hard with the insurance companies to make sure that it is covered. And our plan was like 2024 or 23. When COVID came, they were like forced to accept insurance. So now it's mandatory. Now they are optional and they accept it, but it will be mandatory starting next year. We are focused in Saudi Arabia. However, there are like 5% of our traffic is coming from all over the world, especially Arabic-speaking families who are living abroad in Germany and United States. And also we're serving the nearby countries in GCC and the other regional places.
All right, thank you. Kira, you may return to your seat. We're now going to allow our judges a little bit of time for their scoring, as well as all of you that are in attendance. Please scan the QR code and take part in our scoring as well. And at this time, we'd like to invite our 6th startup for their presentation, Capsula Inc. Come on up. All right, welcome. There's your mic and your clicker. And you have 4 minutes for your presentation. The stage is yours.
Thank you very much for this great opportunity. So, my name is Dmitry, and it's my pleasure to present our digital health platform, Capsula. So, with the platform, we're trying to tackle 2 main problems. The first problem is late diagnostics. The second one is low compliance with therapy, and low compliance is actually the problem for all the participants in healthcare sector, for patients, for physicians, and for pharmaceutical companies as well. So by implementation of our platform, we can increase the level of patients' compliance for drugs and medical devices for about 20%. So how it works, actually. So this is an example of our collaboration with Roche Diagnostics. So here you can see the QR code on the package. Here is the example. The patient is able to scan a QR code and get free support on Capsula. So support includes the help that is provided by physicians, like telemedicine, concierge assistance, and medical coaching, and also automatic system of support like chatbot, behavior tracker, and special database. So there are a lot of blocks in automatic support. We developed special algorithms for a lot of pathologies like diabetes, cardiovascular diseases, etc. And for pharmaceutical companies, we not only increase the level of compliance and their revenues, but also provide them with detailed information, analytical information concerning their customers by creating a direct-to-consumer channel. So our market is marketing budgets of pharmaceutical companies, and this market is more than 7 billion globally. Compared to other platforms, we developed a lot of additional functionality that is valuable for pharmaceutical industry, like doctor-to-doctor communication and analytical engine. We've built a lot of communities across the globe, so our primarily market at the moment are developing countries. So we are targeting on Southeast Asia and Indonesia as well. Here is the example of our customers. So we work with the biggest manufacturers and support drugs on different topics like women health, cardiovascular, diabetes, and many, many more. Our customers, the biggest value for them is like new instruments that we bring by implementation of digital health through their marketing strategy. So we have 3 founders and about 30 people globally that are highly expertise in marketing, digital health, and healthcare in general. We've made a big journey, so it's about 5 years for our company, and we know what strategies are working, and we really know who our customers are. And this year we're going to close 5 million in revenue globally, mostly for Latin America and Southeast Asia, as I said. Yeah, that's it. Thank you very much for your attention.
All right, thank you, Capsula. If you can remain on the stage, and at this time I'd like to invite Ms. Dimitrova to ask her first question with any follow-up questions if you have time, with 3 minutes to go. Go ahead.
Thank you. Just to understand, so essentially the pharmaceutical companies issue a special QR code for your company, or you leverage an existing QR code, and then the patient gets notifications on their phone what they need to do, or it's the doctor that gets the notification?
Yeah.
Like I didn't understand how it works.
Yeah, actually there could be different mechanics, but the like normal mechanic is when the pharmaceutical company is putting itself the QR code on the package, and the QR code is produced by our company, and it is allowed by scanning to go directly to our app and get support.
And what's different from putting the labeling inside the drug that normally exists on how to use it? Like, how is that?
The bigger level of conversion. just works better than like normal word about the opportunity. Yeah.
And who is paying for this service?
The pharmaceutical companies are paying for the support of their users.
And the compliance rate, you've tracked it that with the QR there is a greater compliance rate?
Yes, yes.
And who tracks it, you or the pharma company?
Us.
Okay. So these 5 million come from the pharmaceutical companies?
Exactly.
And the QR code is produced for the specific market, say for Indonesia is a different QR code, and it's all translated, etc. into the language
exactly,
of
because
the
in
user.
each country we have to be compliant with the local regulation, data privacy, etc.
Have you raised any funding rounds before?
We've made a seed round.
Any IP that you have?
Yes, we protected our algorithm for different diseases and chatbot.
Okay, we have 1 minute remaining in the Q&A. Go ahead.
So just had one question. So the fact that the IP was your algorithm, can you explain that a bit too? What is this algorithm that you have an IP on, and what's the kind of disease? Can you explain a bit?
What is the IP? What is the IP? Yeah.
Yeah, what's it?
Thank you. Yeah, thank you. So, the patient is supported by 2 ways, like in-person support, like telemedicine, coaching, and concierge, and automatic support, like algorithms, chatbots, and so on. So this automatic part is protected by IP strategy.
All right. Thank you.
Thank you.
Kapsula Inc. Great stuff. You may return to your seat, and at this time, we'll allow the judges a little bit of time for their scoring. And speaking of QR codes, you guys know where I'm going with this. You can scan our QR code on the screen in order to help us with the scoring as well. And we're going to keep things rolling here with our 7th startup who is also joining us in person. So MyMD, come on up. And as previously mentioned, we're going to put 4 minutes on the clock. The stage is yours.
Hi, good afternoon, everyone. I'm Dr. Raju Ree from MyMD.ai. I've been a pharmaceutical physician before. I worked with Pfizer and AstraZeneca before joining MyMD. So we are a transformative healthcare platform. We use AI for medical education, virtual triaging, and clinical decision support. So the key problems that we are addressing in healthcare are, one is the growing cost of healthcare across the globe. We understand it's growing every year, going to about $6.2 trillion in the US, and across the globe we are seeing huge problems in shortage of health workforce. We saw that during the pandemic, wherein hospitals were getting clogged with patients and patients were not getting beds across the globe. We are also seeing that this will worsen in the coming years if there is another set of multiple diseases coming up. And again, low patient engagement, especially in developing countries, causes around $215 billion increased cost to the healthcare system. So Maya was developed using proprietary training with 25,000 physician hours and 20,000 plus developer hours. So Maya replicates how a physician approaches a patient. So Maya can process any number of combinations of signs, symptoms, lab investigations, past medical history, etc. And we can currently look at 8,600 plus symptoms in less than 2 minutes with a proprietary algorithm. We have research collaborations with leading medical universities, including Yale, Carnegie Mellon, Boston University. And we have also done a clinical accuracy study with UCLA. And we have more than 90% accuracy in the current scenario. So what Maya does is, we have a patient engagement platform which works anywhere, anytime through multiple screens. We have a multi-channel interaction interface which is conversational. and using multiple languages. So we are present in English, Spanish, Chinese, Arabic, Indian languages, etc. We provide clinical intelligence, which is evidence-based, real-time recommendations to the provider, and we can increase the clinical efficacy by 45%. And again, there's a prediction engine which becomes better and better with more interaction with the patient. So we can also predict hospitalization risk based on changing variables with different digital biomarkers. So on the customer acquisition part, we are a B2B platform primarily. We are a B2B2C platform. So we can also provide remote patient monitoring solutions, digital therapeutics. We can also provide chronic care management on the back end. So it helps to reduce the healthcare costs for chronic diseases like diabetes, hypertension, dyslipidemia, which is growing across the globe. And also for surgical cases, we can provide perioperative care. All kind of instructions can be passed on through the Maya platform. And again, we can provide a value-based care. So how we charge is we have a SaaS model for physicians based on number of patients and beds, etc. And for developing countries, we have a pay-per-click model based on number of interactions which happen through the platform. And also there is a revenue share model for small clinics where the revenue generated through our interaction gets billed. So what we do is, I'm just summarizing it, we can do remote patient monitoring, chronic care management, predictive care coordination, pre and post-surgery care, medication adherence, which is a huge issue where we can save a lot of money, telehealth, patient education, and clinical decision support. So we have a good traction right now. We are present in the US, Europe, and Asia. We're currently working with a government health system in Meghalaya where we are doing large-scale population screening for 40+ parameters through our platform for 100,000 families. So why MyMD? One is the robustness of our clinical intelligence is well published and validated. We can give benefits of cost saving, and we can also look at large amounts of behavioral data for predictive algorithms. So our team consists of doctors, engineers, and data scientists who are passionate about healthcare, and we have a combined experience of more than 50+ years. Our ask to the platform would be more on partnerships to reach more patients and doctors in Asia Pacific, and also to reach to insurance companies and pharma companies. Thank you so much.
Thank you, MD. If you could remain on the stage, as we will now allow, we'd first like to invite Ms. Subramanian, who is joining us virtually, to ask the first question. We'll open it, the Q&A session for the next 3 minutes. Thank you.
Thank you. Go ahead.
Ma'am, we cannot hear you.
We cannot hear you.
You're on mute.
You're on mute.
We're not able to hear you
yet, Ms. Subramanian.
There you go.
There you go.
Yes.
Yes.
Go ahead.
Can you hear me?
Thank you.
Yes.
Yes, we can.
Yes. Yes, we can.
Thanks. Can you go back to the screen of what are the services that you offer? I didn't catch that. And so do you offer the medical to connect to the doctor as well at the end of it? Or is it just the diagnosis?
So we provide a virtual triaging algorithm which can be plugged into the hospital system. So the patient or a nurse or a paramedical staff can use a conversational AI to put in the symptoms. And in less than 2 minutes, we can come to a set of differential diagnosis. After that, that is given to a doctor based on where the patient is. So we can guide them to the nearest health system. So what the value addition is, there are times when you don't need to go to a doctor. So we can prevent unnecessary hospitalization. And the second is, we can also say that this is a cardiac emergency, immediate hospitalization.
So what are the things that you're testing as of now, and what parameters are you testing?
So we currently look at more than 8,000 conditions, and we don't cover pediatrics and dermatology right now. Rest all the specialties we cover. And our algorithms look at gender, age, and ethnicity. So if someone is logging in from India with a fever, cough, and breathlessness, it can be a TB. So we look at epidemiological data, the latest epidemiological data, look at which kind of conditions are more common in that country. If someone logs in from Indonesia, they get a very different set of diagnosis. So it's validated with our algorithms and our medical team researching with also.
That's a pretty wide range of stuff that you're talking about. How do you get to that? I mean, that's
yeah. So we are also looking at data. Yeah, pardon, ma'am. I didn't hear you the last part. Yeah.
No, I mean, this is pretty wide range. I mean, this is saying you're trying to. I have saying that look at a few parameters and be able to predict what the next one will be across different diseases you're saying. So just feel it's very vast. So how did you get to this particular thing?
Yeah, most of our algorithms work pretty well in cardiology and chronic conditions mostly. And also, we also look into the past medical history data, which includes the past BP, hypertension, etc. And based on that, the more the patients start using the data, the predictive algorithm starts kicking in. Machine learning algorithms. Yeah, that's how it is.
Okay, we have about 30 seconds remaining. If our remaining judges have any other questions, go ahead.
The team, what's the full team?
We are 6 right now, plus our advisors who are based in other countries. So the advisors are more looking into the data creation, validation of data, etc. But otherwise, we are 6 people who are full-time on this. So Mark is the COO, and I have a team based in India and the US right now.
Okay, thank you, my MD. You may return to your seat while we allow the judges a little bit of time for their scoring. Thank you. We still have 3 presentations remaining for day 1. Just a quick reminder that we will continue as well with our second session tomorrow, right here in the same breakout room. And once again, the QR code is available for you to scan to take part in our scoring as well. And also joining us here today, our 8th startup, Fuse AI. Come on up. All right, welcome. We're going to put 4 minutes on the clock as usual, and I'm just going to hand you the stage. Go ahead. Thank you.
Hello, my name is Sabrina Reimers-Kipping, PhD from Germany in the startup Fuse AI. We founded our company Fuse AI with a vision to reduce misdiagnosis in radiology and improve the diagnostic process. Oh, sorry. Yeah. The first use case that we addressed is the case of prostate cancer and the AI-assisted analysis of magnetic resonance imaging of the prostate, as prostate cancer is the most common malignancy in men worldwide. And misdiagnosis in MRI image interpretation is a big problem, leading to either undiagnosed prostate cancer and thus uninitiated treatment of the cancer, or to the unnecessary biopsy of the prostate itself, which is harmful. Additionally, the process of interpreting magnetic resonance imaging data is very time-consuming for the radiologist and can be easily sped up when using artificial intelligence and computer vision methods. So we produced our first solution, prostate carcinoma AI, which exactly does that. It creates automatically markings of relevant target structures of prostate segmentations, zone segmentations, and segmentation of suspicious lesions, making it much easier for the radiologist to come better and quicker to the solution and to the diagnosis. Our first clinical results prove that what we actually claim is true and that we can improve the diagnostic accuracy and as well increase the time efficiency of the diagnostic process. We are currently undergoing certification as software as a medical device and will be ready by the end of the year to commercialize in Europe, Northern America, and Australia. The time saving that we can provide to the radiologists using our software actually directly can be translated, oh, something's mixed up here, can be actually directly translated into increased potential revenue for the radiologist since he can perform more reportings per day. Our solution is available as a plug-in into existing diagnostic viewer softwares where it is seamlessly integrated and there's no need for the radiologist to actually switch their diagnostic tools completely, but they can actually just add in our new functionality into their existing diagnostic infrastructure. Wow, there's again something missing. Oh, I don't know what happened here. So what we have as a solution is actually not just a single product, but it's actually an AI backbone with which we can generate even more solutions to other medical indications quite easily, such as lung, breast, or bladder cancer in the future. Our revenue model is actually going hitchhiking with existing diagnostic viewer software providers and making or using their existing customer base and trust for our revenue model, leading to a revenue potential of approximately 1 million euros with our existing partner, MidMedical, where you already have seen the integration in our test installations, and we are currently negotiating with further partners, making it possible to scale up that number easily. I've talked about that before, and that's at the wrong position. Yeah, so we hope that we can actually be in the situation that in the future diagnosis will be made with AI support so that they will be better and quicker.
Thank you, Fuse AI. And I'd like now to invite Mr. Sethi to kick off our Q&A session for the next 3 minutes.
Right. Just so where are you in the value chain, right? So I do the MRI, and then what, right?
Sorry?
So where are you in the ecosystem? So I do an MRI.
You as a patient, you will not realize whether the radiologist comes up with an AI-supported diagnosis or whether not. So we talk to our distribution partners, which are software providers, and radiologists actually use our software. So for us, it's a B2B business that scales up easily because we don't have to generate a big sales organization, but we talk to just a handful of partners.
Right, and I would go to the lab again because the lab's result was more accurate, right?
Sorry?
Like, how would you get repeat customers, right? Like, if you're not in the picture, how do you get more revenue?
Yeah, actually, I don't know, some of the slides were missing and mixed up. I don't know what happened. I had actually a slide about the competition because the competitors come up with their own standalone solution, making a complete switch of systems necessary. We don't do that because we partner with the existing solutions and we go along with these. So despite being an additional competitor to these existing companies, we try to partner with these and strengthen their positioning within the market. And from what we know from our discussions so far, they actually want to have these kinds of solutions in order to strengthen their position and enhance their market share within their market segment. So we both benefit in comparison to the other competitors.
Do you have data from the radiologists, how frequently they altered their opinion based on the AI-enabled analysis, or they don't confess that?
You mentioned something that's really tricky because doctors don't like being told that they are making mistakes. So they are well aware that it's a problem. What we actually see is that we do improve both dimensions of misdiagnosis. While radiologists are rather good in spotting cancer, what we mainly increase is the specificity. So we can reduce the number of unnecessary biopsies because they are able to rule out things that the AI has not marked in the first place.
And what traction do you have to date on the market? And
yeah, so we are currently being certified, so we cannot sell our solution yet. What we have is test installations in Germany and Switzerland, and together with our partner, MidMedical. And 2 clinical studies, one already being performed and one still running, where we actually received very positive feedback from the clinics and really convincing data concerning time efficiency and diagnostic accuracy.
Okay. Thank you, Fuse AI. All right, you may return to your seat, and we'd like to allow the judges A little bit of time for their scoring, as well as all of you to take this opportunity to scan the QR code and participate as well. We have 2 startups remaining. We have one joining us virtually, which will round off day 1, but in the meantime, we have one more that is joining us live here today. And at this time, I'd like to invite MP to come on up on the stage. Been waiting patiently. Thank you so much. Welcome. And we're going to put 4 minutes up for your presentation. MP, the stage is yours.
Hello, good afternoon. My name's Ben, and I'm here to talk about MP. At MP, we all believe in the idea of empowering people to be able to manage their own health. When we look at healthcare today, we're seeing a transition from a traditional healthcare structure into one that is slowly adapting and absorbing new ideas such as virtual consultations and telehealth. We believe that further adoption of new technologies such as AI is the next step. With NP, we see this affordable adoption of AI being utilized in a preventative approach through the combination of our patented IoT device, which measures 6 vital signs, including a 12-lead ECG, in combination with our AI-powered symptom checker, which is clinically validated at 92.78% accuracy. This allows for the combination of both quantitative and qualitative data. Looking at the services we currently provide and the outcomes from that, we realized very early on that we didn't impact just B2C, that we also impacted B2B and B2G. For example, B2G, we realized very early on that we designed a platform from which you could look at the population's health, you could manage it, and you could also produce a large amount of big data real time that could be very useful in analytics. Looking at B2B and B2C, we not only have a patient and clinical end-to-end journey, but we also have a product that is user-friendly and centralized at home for anyone to use whenever they want, any time of the day. On top of this, we actually by design are able to seamlessly integrate with other services such as national health services, absorb electronic medical records, or even insurance providers. And we also have the ability to adopt other services that are beneficial to the human being. So ambulance services or emergency services, for example. Looking at the patient-centric journey in a simplified form, our AI and our application works as a smart gatekeeper from which an individual will provide a certain amount of information based off some questions, which will then allow the AI to select the appropriate path, the appropriate appointment for them at the appropriate healthcare facility. They will then be given the option to have an in-person consultation or a virtual consultation. From here, the doctor will then validate the diagnosis with the NP application, which will then align with ICD-10 and CPT codes from insurance providers, allowing for a very fast and efficient payout. And very simply on the clinical side, it's the exact same but reversed. So the clinicians receive a request for an appointment and they receive the information from the application, from the symptom checker, the level of urgency or pre-existing medical issues. Looking at the current market landscape, we can see that there's $188 billion growth in the IoT market in healthcare by 2025. And 38 billion in AI by 2025. We also find ourselves in a uniquely situated niche in the market where we have a combination of both an IoT physical device and an AI application powered by AI. Our leading team is comprised of many clever individuals, but I'll summarize the 2 main individuals, I'm short on time. There's Dr. Gabriel Cajo, who is one of the leading gentlemen in Europe in AI, and Dr. Philippe, who is a leading medical professional who's worked extensively with NATO and the EU. To round that off, our chairman, Sam Talib, has decades worth of experience internationally and especially in the MENA region where we are based. It's a very international team. Our headquarters is based in Dubai, but we do have an outreach across the world. Finally, for our attractions and partnerships, we are strategically partnered with the DHA, which is like the National Health Service of Dubai. We have a strategic commercial partnership with Ernst & Young, and we have many individuals across the MENA region who have placed pre-orders on our unit pending FDA approval. Thank you very much.
Thank you, NP. And if you could remain on the stage, Ms. Dimitrova, if you'd like to open our Q&A session for the next 3 minutes. Thank you.
Thank you. I'm still trying maybe the first slide to understand what problem you're solving for. And
could we put up the first slide,
and
please?
what does it actually do? I understood the booking of appointment, etc., but I don't fully understand the solution.
So actually, the company was founded just before COVID-19 hit, and originally it started off as a very simple AI symptom checker. If you've heard of a company called Babylon, it kind of followed the similar path as them, and the innovation that we had was a device attached to that, especially the 12-lead ECG, which is one of a kind. There's nothing else in the world that isn't a $20,000 medical machine that you can have at home as an individual. But due to COVID and the slowdown that happened, we ended up doing a lot of research and development in the company, and slowly it started to expand into this massive end-to-end solution where we just want to help individuals. So the original goal was to ensure that every individual had the access to the medical care that they deserved as a human by making this affordable AI an affordable device. The scope has just changed, but the goal is still the same.
We still have some time if the judges have any questions.
Do you have any existing revenues?
No, currently not. We're still in a startup stage. We are, once FDA approval is cleared, which is expected now in about 3 weeks, that's when we'll start, or that's when we'll launch from the UAE.
Still have a bit over a minute remaining. Ms. Subramanian, perhaps, if you have a question, you could just go ahead and ask. Okay, if not, thank you so much, NP. You may return to your seat momentarily while we allow the judges a little bit of time for their deliberation and scoring. Thank you. All right, judges as well as invitees, if you could take part in our scoring one last time, if you'd like to scan the QR code. We are supposed to have a 10th presentation, however, that has been moved till tomorrow. Again, a reminder that day 2 will take place right here as well in this breakout room. And at that time, I believe we have another 7 additional presentations to get through tomorrow. Yes, they've been moved to tomorrow. Thank you. And as soon as the judges are done with the scoring, we're actually going to have a group photo with everyone, so I hope everyone's still here. Okay, we'd like to invite all the participants from the 9 startups, so the 7 in attendance here, as well as the 2 that took part online. I believe it was, trying to remember here, it was Heidi Health was the first online participant. If you're there, if you'd like to turn on your camera, as well as Arficus Private Limited, if you could also turn on your camera. And judges, if you're done with your scoring, we'd like you to join up as well on the stage. Mr. Sethi, Ms. Dimitrova, as well as Ms. Subramanian, if you could turn on your camera as well so we could get you up on the screen here to get a group picture. Yeah, we're a little bit crowded, so we're going to make 2 lines, I think. We're going to try to make way for those that are online so we can put them up on the screen as well. Great stuff. Thank you, everyone. So that brings our day one almost to a close. In the meantime, thank you all for the startups, especially for taking part in day one of our event. On behalf of the entire committee here, I would like to thank all of the judges as well, the startup founders, and all of you guests that are in attendance for taking part and participating as well. It's been a very fruitful first day of our two-day panel here. For your information, the next item on today's agenda will be the one-on-one business meeting that will take place at the BICC Nusantara Foyer. We also have a gala dinner that we hope that you'll join tonight as well. That will be held at the Taman Bagawan at 6 p.m. Now, Taman Bagawan, in case you're not familiar, is actually off-site. It's outside of the Western Resort. So, to get there, we're going to provide shuttle services that will be available starting from 5:30 p.m. That will be available at the lobby area. So make sure you're there on time at 5:30, and that will take you to the Taman Bagawan for the dinner tonight. My name is Paul Palella, thanking you all once again. Hope to see you tomorrow for day two. Thank you, and recover together, recover stronger. Take care.